A little bit of joint flare post-operative. The biggie in the States is not really dogs, although it's getting up there. The biggie in the States is horses. They do this in horses a tremendous amount. When you consider that a thoroughbred racehorse weighs approximately 800 kilos and it's running at about 40 kilometres an hour, and if you watch a horse run in slow motion, you will see that each leg hits the ground individually. They don't hit at the same time, so it's bang, 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 bang. Okay, whether they're a left lead or a right lead, it's all 1, 2, 3, 4. When you also consider that those animals have that, they land on that, okay? That's what they've got, one digit, all right? And you imagine the force of these animals running at that speed, weighing 800 kilos, the pressure they put on that one single limb. That's the reason they always end up with bowed tendons and fractured sesamoids and bone cysts and all the rest of it. And when they're out for about 12 months. They take a long time to heal. I remember one animal when I was going through my university course called Planet Kingdom. He was a very, very successful racehorse, and he was worth quite a few $1 million. They plated his fractured tibia, his cannon bone rather, and they floated him in a tank for 6 months. He floated in water for 6 months with a plate on. That's how much they tried. And when they got him out, he went well for about a couple of weeks, then fractured it again. There's just too much force on that sort of stuff. So stem cells have lent a lot of hope for these animals. They're worth a lot of money at stud, literally millions of dollars at stud. So you want them walking. So in the States, it's very big. They held the first regenerative medicine conference just north of LA last month, and mostly the vets there, were about 350 of them, were all horse vets. Only a few of us little dog vets that no one want to know about. So people look after their dogs quite well in the States, as you'll see from this video. So that's the sort of stuff we see with dogs out here. I've got to say, as a veterinarian, it's very gratifying to watch dogs that were basically crippled and in pain, and we'd fill them full of non-steroidal anti-inflammatories and all the rest of the stuff, and they'd do okay, but you know, they were struggling. And when you get ones like this that just basically can chase a ball again, there's no placebo effect in dogs. You just can't tell them it's going to get better, and it's not going to get better. But yeah, that dog did very well. Who'd want to be a squirrel in the States, eh? Okay, look, just in closing, I'd like to just leave you with a quote from Barack Obama. When he said last month that in summary, adult stem cells have shown by the published evidence to be more promising alternatives to patient treatments, with a vast biomedical potential. Adult stem cells have proven success in the laboratory dish, in animal models of disease, and in current clinical treatments. Adult stem cells also avoid the problems of tumour formation, transplant rejection, and provide realistic excitement for patient treatments. I think that stem cell therapy will become the gold standard of therapy for a lot of diseases that were previously untreatable. I'd like to close by thanking all my colleagues, particularly my cousin, Dr. Wayne Thomas of the Children's Brain Cancer Research Foundation Lab out at Randwick Children's Hospital, who's been very helpful to us, and all my technicians as well over the last 4 years. And thanks to James for inviting me. Thank you. Firstly, if you go back to what I was talking about, adult stem cells, there are very few in the tissues to do the job. Basically what we're doing is increasing that by a factor of, literally millions. So it's probably a numbers game, plus the fact that they're dormant in those tissues. And a lot of these diseases are chronic diseases that we're treating, so they don't really get the wake-up signals that they require. So yeah, it's a numbers game, really. Yeah, yes, that's quite true. But I also have to say that with our work, we take all the animals off all medication at least a week prior to harvest for that reason. But on the other hand, we will often give these animals non-steroidals by injection post-operatively for 24 hours, and that doesn't seem to affect the clinical results that we're getting. But we do take them off everything, yes, before we harvest. Yeah.
If this develops into something that becomes a gold standard, like you say, is it likely to be affordable? Is it something that's going to be...
Yeah, I'm sort of waiting for the cost issue to come up here. I'll give you an example here. Who remembers the first mobile phones that came out? Yeah. It was a brick, yeah. You could use it as a defense mechanism, really. But not many people could afford to have a mobile phone, and they were expensive. They didn't work particularly well, and if you saw someone in a restaurant using it, you go, oh, wanker, But now, my mother's got a mobile phone. Everyone's got one. The uptake of them is huge. So what happens is, as technology develops, initially it's Very few people take it up because they can afford it. These early adopters can afford that. It doesn't work very well. Then it becomes less expensive and works better, and eventually it becomes ubiquitous. I think the way things are going in that area will be that the hardware will be free, and the information that you get from the hardware will be what you spend it on. If you want to get a ballpark figure of our treatment, if you live on the North Shore of Sydney, it costs you about $6,500 to do your dog. If you live on the south side, it's about $2,500. Canberra, it's very expensive, I don't know. Depends if you're Julia Gillard or something. Charge extra. So yeah, in the States, it's coming down all the time. As more players enter the market, there was initially only us doing it on a research basis, and then a company called Regenius out of Ku-ring-gai started doing it with the University of Technology in Sydney, and they were charging on a commercial basis $6,500. Admittedly, they could actually, we can get into hips and stifles and elbows and shoulders with little problem. To get into things like facet joints, a CT guide is what you need to do that. CT machines are very few and far between in veterinary practice. The Ku-ring-gai guys have one. We don't.
With that fellow that had the great response with his hand, would you expect infiltration in just about any condition?
Yeah, look, I got to say that I'm a fence sitter, you know, when it comes to technology. I tend to wait for the scientific evidence to come in to do it. The guys in the States are going, you probably heard that last video, they're using it for animals with liver disease. Now, I'm not convinced, and the guys at Monash are not convinced either, that if you inject intravenous stem cells, do they get through the lungs to home? Obviously they do, but that picture there doesn't convince me, because there's an increased blood supply to areas of damage. So therefore you will naturally get more cells because there's more blood going to the area. I know that only about 2% of the cells you inject intravenously will get through the pulmonary first pass scenario. Are they enough to do the job? Depends who you ask. The guys in the States go, yeah, more than enough. They're injecting 1 million cells per kilogram body weight intravenously 3 times a week apart. They grow them up in the lab and they can do that with that sort of number of cells. We don't have that ability just yet out here. But the answer to your question is I don't know. I mean, it works. So obviously they get there. Yep.
In regards to an application to the sports side of things, if you've got an athlete which has a huge muscle tear, it does not require surgery but has a lot of muscle atrophy and muscle tear, have they explored with this?
Yeah.
In regards to healing muscle tissue, even if it is something which happens, say, years prior because there was no mode for healing?
Yeah. Two-part question. Firstly, will it work in old injuries? Answer that's yes. Second question, there's a doctor in Sydney, Dr Nathan Gibbs. You may know of Nathan. He was a footballer in South Sydney for a few years ago. He's doing this sort of stuff regularly, something like 3 or 4 patients a day now, working with a group that we work with as well. I'd have to say that regenerating muscle tissue from muscle atrophy is certainly a stem cell property, that you can do that. But I also think that gene therapy for stimulating myoblasts to begin the process of dividing is probably got a bigger application to do that, and there's a lot of work being done on that scenario too in the US. Gene therapy and stem cell therapy pretty much go hand in hand a lot of times.
When you say Nathan Gibbs is doing this, what exactly is
He's injecting mesenchymal stem cells directly into knees, and I think he's doing muscle regeneration as well. But yeah, I'm sure he'd be happy to hear from you. I mean, he's happy to hear from anybody, really. I mean, I ring him up all the time. Yeah.
Would that lead to a bit of a dark side in that people use it as a
Oh, yeah. Yeah, look, in any technology there's a dark side. You know, the paradigm is that as a species, we tend to go and develop things that will cure disease. That's what we aim for. But in everything, healthy people will take it up too. You can't tell me that EPO, when it was first developed to generate red cells in people who are anemic, the guys who ride the Tour de France didn't go, oh, I'm feeling a bit anemic, I might take some EPO. You know. So there's always going to be people who do that, always. And that opens up a whole new conversation about how we enhance ourselves. You know, eugenics. Do we go and choose our babies with blue eyes or the ability to play a concert, you know, pianist? You know, I mean, you can go on that discussion forever and a day. Yes, the answer is yes. People will always abuse technology, no matter what you do.
Would it be with stem cells or gene therapy? Would it be detectable? Would we know at this stage if it was going?
I do dogs. You know, hey, I don't know. Yeah, mate.
Last one. Tough question, but how long is this, do you believe, will be commercially available to us?
You know, that question bugs me. It bugs me because every time you hear this, the same answer comes out. Oh, 5 years? You know, it's 5 years because of the regulations that you have to go through to do this. To get a new drug on the market will cost you $5 billion and at least 5 to 10 years of trial work. This stuff is here now, and it's commercially available now. I can take my mother to a place in Melbourne and I can go, give my mother intravenous stem cells, please, and they'll do it. Okay? You can take your dog to the vet in certain veterinarians and they can do this too. The technology for this is here and it's happening right now. I mean, you look at that Regenix guys in the US, they're doing it now. So yeah, you can go get stem cells in Germany if you want to do that for MS.
Is there some kind of political, I'm trying to think of how the pharmaceutical industry is obviously massive. Is there a political sort of opposition to what's going on with you guys?
Nobody cares about vets, really. I mean, oh, okay, shut up. But
There's a lot at stake for the pharmaceutical industry. They make
yeah, I mean, I'll give you an example in my field. The APVMA, who regulate the veterinary industry chemical side of things in Canberra, they fence sit this one. They view this, what we do, as a graft. It's an autologous graft. I'm taking some tissue from you, putting it back into your body again. It's just a graft. It's a procedure. So they've copped out of that one. There would definitely be some serious lobbying going on by very large big pharma companies to take this away from individuals and make it a product, a chemical. So yeah, there'd be huge amounts of lobbying in, massive. So get in while you can. Okay. See you, vet. Did you want to use this?